not by lighting a fire beneath them, but by building a fire within them to actually get activated within yourself. You know, I can feel the motivation for you, but it's not until you feel it yourself that you can make real changes. So we are located in Pickerington, Ohio. This is our office where we do coaching, consultations, and we also give talks at our office as well. So what is anxiety? That sense of worry, fear, nervousness, that uneasiness that starts brewing inside of yourself, whether it's related to an event or the fear of something that may or may not happen, is what anxiety is about. Now, we all have it at some point or another, and it can be very normal for us. Sometimes it's that excitement before something that you really want to be involved in. The problem is when it starts interrupting your life, whether it's interfering with your relationships, your employment. People that have high anxiety have higher rates of suicide. It's when anxiety starts to take over, and not something that you're just anticipating in how we experience life, but it's actually how we experience everything in life, is when anxiety becomes a problem. So there are 5 major types of anxiety. Generalized anxiety disorder, where you're experiencing uncomfortable anxiety with nearly everything that you're doing, with major and small events in your daily life. Obsessive compulsive disorder, where you're focusing on one single thing and cannot move beyond it. Panic disorder, where you're having fears of doom and high symptoms of anxiety that can last from 2 to 10 minutes at a time. Post-traumatic stress disorder, where whether you've actually experienced or witnessed a traumatic event and then you have triggers and continued experiences related to that. Or social anxiety disorder, whether it's one-on-one or being in groups where anxiety takes over and it doesn't allow you to experience things in a comfortable and enjoyable way.
You have all 5 at the same time.
That would be disruptive, but in some ways I suppose you could. Now, just to be up to date with everything, obsessive compulsive disorder was recently removed from the DSM-4 in DSM-5. So in DSM-4 it was part of panic disorder. They removed it and put it into a stress category, and PTSD was actually also removed and put into a traumatic category. So when anxiety is passed as one of the new diagnoses for medical cannabis, obviously PTSD is already an acceptable condition on one of the 21 conditions for cannabis, but I'd be curious to see what happens with obsessive compulsive disorder. Of course, there are other types of anxiety as well, whether it's separation anxiety, mutisms, phobias that many people have, agoraphobia, you're afraid to leave your home or going outside, but there can also be anxiety induced by medication or by a medical condition. So all these are different forms of anxiety that people experience.
What's the second one?
Mutism,
Yeah.
where sometimes you've seen a child that have had a traumatic event and then they shut down.
Oh, okay.
And so it's within the anxiety category. So what are the symptoms of anxiety? What do people actually experience? People with no experience with anxiety can say things like, just have confidence, take the plunge. Life is too short to be sad. It's all in your head. Get some guts. Why can't you just cheer up? But finding the courage isn't so easy. So when you have the physical and psychological symptoms of anxiety, you start getting that shortness of breath, and then you feel your heart beating a little bit faster. And with that, you start feeling a little bit more lightheaded and dizzy because you're not getting that oxygen to your brain. You start getting sweaty and your muscles start getting tense. Along with that, you end up having some difficulty sleeping, possibly headaches. Those are the physical symptoms of anxiety. Along with that, that feeling of dread and doom, intense fear, restlessness, and irritability. So some statistics. Anxiety disorders are the most common mental illness in the United States. 40 million Americans have anxiety disorders. That's 18% of the population. That means 1 out of 3 people are actually are seeking treatment. The majority of people are not getting the treatment that they need. And with that, $42 billion are spent on anxiety disorders, still with that every year. 3 out of 5 people with anxiety disorders are more likely to go to the doctor. They're searching for something, but not necessarily finding what they need. And of course, the risk factors, it can be genetic, it can be your brain chemistry, it can be simply your personality, and of course, it can be life events that have gotten you to a point of severe anxiety. So, the pharmacotherapy of this, what happens when you do go to a physician? It's number one, you're going to get started with an antidepressant. Whether it's Paxil, Effexor, Cymbalta, Zoloft, any one of these, and of course there are many more of them, that is the first line. So along with that will come a variety of side effects depending on the person, and it's difficult to find the right medication for the right person. If you are able to find it, God bless you, you've done well. But for many people, it's hard to find the right one where the side effects don't overpower what the medication was supposed to do initially. A lot of trial and error. So many times with patients, if we're choosing to go this route, I'm telling them for the next 2, maybe 3 months, we're going to be bouncing back and forth. If you can find it the first time, you've done extremely well. So second line are going to be the benzodiazepines, whether it's Xanax or Valium, Klonopin, which is a longer acting benzo. A lot of these can be helpful, but they can be very addictive for people. They can kind of stall your life experience as well. Have actually caused more sleep issues, whether it's sleepwalking, sleep terrors, what have you. It can go on and on. And so there's obviously, these are the best options that we have currently, but there's a lot of difficulties with them as well. So some other options that people may or may not like as much. Buspar is a medication that's in a category by itself. It's mainly for generalized anxiety, but it takes weeks for it to work. And for a lot of people, it doesn't ever kick in at all. And the variety on the dosage can vary quite a bit, but it actually should work. It connects to the serotonin receptors. For a lot of people, it doesn't seem to do really well. Then a lot of off-label use. So there's Lyrica, which is an anticonvulsant. The main purpose of this is that it makes you pretty sleepy. And if insomnia is the biggest part of your issue, then this is something that people will add to your regimen. Not as a primary part, but we'll add it to the regimen that you already have. A lot of people use antihistamines. Again, it makes you sleepy. It does have a slightly calming effect, but then it's still an antihistamine. It's drying you out. There's Remeron, which is it is an antidepressant, but it increases your appetite well, and if that's what you're looking for, then it's a great medication for that. But they do find it helps a little bit with anxiety. And then Seroquel is an antipsychotic that is usually added to a regimen, mainly again to add to sleep. But really, we're really talking about 2, maybe 3 major options as far as treatment for anxiety at this point. Now, I never want to ignore or belittle the benefits of therapy. No matter if we're talking about cannabis or the medications, nothing really stands on its own. And so they find with therapy, whether it's doing psychotherapy that's kind of digging into who you are and how you got to where you are now, or whether it's cognitive behavioral that looks at why you think the way you do and why you do the things that you do, and finding a new way of you thinking. Exposure therapy is quite often used for PTSD, slowly exposing you to the environment or the issues that have caused the issue to begin with. A lot of therapy is done one-on-one, but a lot of people will do group therapy. If you have similar symptoms, usually the therapist counselor will put several people together so that they can work together on it. Wellness coaching tends to happen after people have gotten to a place where they're doing a lot better, but having trouble reaching the goals that they would like to reach to get to a better place. And then biofeedback and hypnosis is something that's usually used in conjunction with these other forms of therapy. So biofeedback, where you're actually learning what your heart is doing, how you're breathing, how some of those symptoms that happen with anxiety, and if you're able to understand what's happening, you can actually slow your heart rate down and slow your breathing down. It's like is it the chicken or the egg, which comes first? If you understand the outcome, you can actually revert it. And hypnosis kind of getting into the back end of your brain and seeing if you can fix it from there. Surprisingly, people think that doing therapy for anxiety is a long haul, but most people show some form of improvement within 8 to 10 sessions. And of course, whether you're combining it with medication or doing it alone, you can see over here that they're using Zoloft in this particular study, that the combination of therapy, and it was cognitive behavioral therapy for this study, along with Zoloft, had more improvement than when it was Zoloft or therapy by itself. So again, we can't ignore other forms that help treat anxiety, and nothing works by itself. So whether it's changing your eating habits as well, increasing your protein, your fiber, omega-3 fatty acids, which actually help quite a bit with repairing your cannabinoid receptors, so a very important part of your diet. Your fruits, vegetables, and decreasing your alcohol is an important part. So even talking about omega-3 fatty acids, a lot of the CBD oils that you might purchase, or just going to the grocery store, hemp seed oil that does not have any CBD in it at all, is higher in omega-3 fatty acids and protein than flaxseed and chia seeds. So some people kind of boo-hoo on hemp seed oils because there's no CBD in it, but actually it's a good thing to add to your diet. And with exercise, it's reducing your stress. It does release more cannabinoids. A lot of people think that adrenaline feeling that they get, that runner's high, it's assumed that it's actually your endocannabinoids that you're kind of releasing during your exercise. So that feel-good feeling is actually your endocannabinoid system at work. You're also releasing serotonin, which you work with as far as getting over depression, what have you. Whether it's walking, cycling, swimming, whatever form of exercise kind of gets you into a better place physically and mentally is a good thing to do. And then relaxing, whether it's yoga, reading, meditation, long baths, whatever gets your brain into a better place of healing and relaxation is something to consider in your regimen for treatment. So cannabinoid treatment, CBD and THC. So originally in writing this presentation, I was coming here saying that anxiety was going to be one of the new diagnoses that you could get a medical cannabis card for. That did not happen. So, but there are still amazing options that you need to consider, and we will be looking, I believe, at that anxiety and autism to be voted on in July. So it's still on the board. It hasn't been rejected completely, but it did change the tone a little bit. So cannabinoid treatment, CBD. So I want to look at a couple, at some studies, because a lot of work has been done in this area already. So the study that I'm referring to in neurotherapeutics, they looked at 49 preclinical, meaning testing with animals, clinical, epidemiological studies were reviewed. CBD was strongly supported as a treatment for anxiety disorders. So they found in these studies the dosing that they found were to be effective in these studies were between 300 and 600 milligrams. I'm not suggesting that is what you should be taking, but I am showing you that in these studies, they were using high doses. It was mainly for acute phase anxiety, so not necessarily long term, but in the moment. But I want you to understand that there's a wide range. Many times people are afraid to go beyond their one dropper, and a one dropper might be right for one person, but it might not be right for you. And what's in that dropper varies between the company, the product, what have you. But they found that between 300 and 600 milligrams, there was a decrease in the fear expression, enhancement of fear severe extinction and prevention of long-term anxiogenic effects of stress. And so when it says long-term, it was within the measures of the study itself. But they found CBD to be helpful and to be effective, and they were looking at 49 different studies at that time.
They're saying 300 to 600 milligrams over what time period?
So most of these studies were acute phase. So the major study that this really focused on was people that they ended up having to do public speaking. And so they were providing different milligrams of CBD prior to them doing the speaking. So this was acute phase.
So one-time dose?
These were one-time dose, so these were not long-term studies. So what they found is that how long was it lasting afterwards is when they're talking about the long-term effect of it. But these are all acute phase. So meaning that for yourself, if you're taking it daily for anxiety, you might need a lot less than something in a very acute, stressful situation. Okay. So one of the things that they did find with CBD, and the reason it was effective for anxiety, was because it actually is connecting to the same serotonin receptors that your antidepressants are connecting to, as well as to the CB1 and CB2 receptors that CBD activates your internal endocannabinoids. So this is important because it provides that same activity to those same receptors those antidepressants offer, but without the severe side effects that a lot of people suffer with. So another study they did, this one in particular was, this kind of goes into what we were talking about, that they divided groups of people into placebo groups, Klonopin groups, so it's a long-acting benzodiazepine, and 3 groups of people that were taking CBD. And so they each were given their dose, I believe it was all in pill forms at this time, and they had to perform their stressful activity, and then they were studied, evaluated afterwards. And they actually found, so the lower the bar, the better on this one, okay? And so they found that people actually had less anxiety, post-anxiety symptoms at 300 milligrams versus the 100 milligrams of CBD, and as well as the 900. So a little might not get you there, but a lot's not going to do that much for you either. Go ahead.
So, when they received the Klonopin and CBD for the most effective outcome?
No one was on any 2 medications. We were either on nothing, or a sugar pill basically, the placebo, Klonopin, or one of the doses of CBD. No one was on a combination of the 2. Maybe I'm faster. Okay, and the 100 milligrams. And keep in mind the 300 milligrams of the CBD did better than the Klonopin as well. Yeah, before I get into what would be the best options for you, I want to at least mention, so if you went to a dispensary, some of the words are going to come up that are going to be helpful. And so the one thing to consider is that there are terpenes as well. And so those are the essential oils of the cannabis plant, okay? So what makes one cannabis plant different? What makes, if you have 3 different strains of it, that are the same, let's say, percentage of THC and CBD, what's going to make one better for you than the other is really when the terpenes get involved. And so the terpenes are like essential oils. Not only are they providing an aroma, but they're also providing healing as well. So you'll find that with limonene here, you'll see anti-anxiety as one of the therapeutic effects. With linalool, which is more of a lavender, you'll find a sedative and also anti-anxiety. The myrcene, actually, it doesn't list it here, but well, it says sedating, and so a lot of people add that into a lot of the anti-anxiety options when it comes to cannabis as well. The carfilline also is used to with anti-anxiety as one of the options. So the other thing to consider, and I hear this all the time, is there's dispensary CBD from cannabis, and then there's hemp CBD. At the end of the day, CBD is CBD is CBD. Whether it's, if you're taking vitamin C, you don't discriminate between the orange and the grapefruit. Vitamin C is vitamin C. And when you're talking about CBD, you're talking about an active ingredient. It is not any different one to the other. You will see that with hemp, which are the products that are sold here, that there's a higher concentration in hemp versus marijuana, but how they pull together these plants or make the strains and then do concentrates, at the end of the day, how much is in it is based on how they created the product. So there's hemp, and then there's marijuana. And then you're also going to hear at a dispensary about sativa and indica. So the real difference here, so these are two different cannabis plants. You'll find with sativa, people talk about feeling creative and energy and alert and happy. And with indica, they feel a little bit more relaxed and ready to sleep. I'm not going to say one is better than the other. I've had people take indica, say they'll never touch it again, that they felt like they were sitting in a coffin. I've had people take sativa and feel like their brain was about to blow up. Everybody is so different. I'm not suggesting one is better than the other, but I want you to at least be aware of the difference, and you you have to figure that part out for yourself, unfortunately. But these are other things that will pop up. So in looking at different strains that might be helpful for you, you can go online, look at anxiety and cannabis and find, 50 different strains that they think will be great. But if they're not local, then that won't be very helpful for you. So I went through what the local dispensaries are offering and want to kind of give you a few different options that I think will be helpful for anxiety. So the first local strain is ACDC. So this is mainly a CBD. It is 18 to 1, meaning 18 part CBD, 1 part THC. It's sativa dominant, so you might have some alertness with it, but it's still mellowing, and it decreases pain and inflammation, depression and stress, and it's great for daytime use. Now I put hemp CBD in the same category simply of how potent the CBD is, but keep in mind this is going to be 0.3% THC, where CBD, the ACDC is going to have more THC in it, simply based on it being a cannabis plant. The next one is Shark Shock, which is going to be a 1-to-1 ratio. So the THC strain is 1-to-1. In this particular one, I think it's 6% THC and 8% CBD. So it's more of a hybrid. It's going to have a little bit more of an apple citrusy taste and have like a sweet fruit aroma, but it decreases pain, depression, nausea, and stress. It's great for thinking clearly and possibly daytime use. And the last one here is blueberry, besides that it's very pretty. It is kind of a middle of the road level of THC. It's an indica strain. It has the aroma and taste of blueberries. It decreases pain, stress, anxiety. Also said to help with PTSD and insomnia. It's called a one-hit strain, so that even though it's not a high THC, you just want to be very careful with it because it tends to still feel very potent and is better for evening use. So the one thing I do want to mention here is that we're talking about the CBD, but when it comes to the THC in treatment, there's very much like with CBD that you find that right amount, and then too much might not be as helpful. When it comes to THC in treating anxiety, they have found that a lower dose, typically in studies, 7.5 milligrams was very helpful for anxiety, but anything going towards the 12.5 milligrams was actually found to increase anxiety. So typically what we're looking at is a low dose of THC if you choose to use it for anxiety, and a higher dose of the CBD. So then when you're looking at a more of a hemp-based CBD, being that we did not get approved quite yet, right? The one thing to consider is what is the concentration that you're getting? Whether it's a full spectrum or an isolate, a lot of people say which one should I pick up, really depends on what you're looking for. So making sure how much are you actually getting with each dose, and kind of going back to the milligrams that we were discussing before. Also be aware of how much you weigh, your body weight, your body makeup will make a difference in how much will take in. That someone that is smaller might need a lot less than someone that is a larger person. And then also your experience with cannabis and CBD. That if you have a lot of experience, you might need quite a bit more. Where if you have very little experience, you might do very well with a small amount. And then lastly, what is your desired effect? So this chart here goes through what CBD, which is the big orange dot, kind of helps with versus some of the other cannabinoids, and the dark red dot, or I guess maroon dot, is THC. So if you're just looking at anxiety, then a CBD isolate would work well for you. But if you're also going to add in that you're also looking for it to help with insomnia, which is a CBN cannabinoid, then you might want to go more towards a full spectrum. So this kind of helps you distinguish when you would want just an isolate and when a full spectrum might be easier for you. So in summary, the studies have proven that cannabinoids help with anxiety. And as I said, the THC lowers anxiety. THC at lower dosages, the 7.5, actually helps a lot better than a higher dose, which actually might increase your anxiety and make you a little bit more paranoid, a little bit more anxious at times. CBD tends to lower anxiety pretty much at many doses, if not all. However, it's important to find the right dosage for you. And I do mention that 300, 600 can be a high dose for a lot of people. And so I'm not suggesting that you go and take 600 milligrams, but I am showing you what could be done, and that if you're only focusing on a 1 ml or one dropper and you're not finding any effect, you might need to move on from it. And the combination of a low THC with a higher CBD might be the best effect for you. Okay, that's it. Thank you. Are there any questions or yes?
The droppers in milliliters.
They're mLs, yes.
So you talk about milligrams.
So So the mLs are the amount that you're taking in as far as the liquid, but so you could take 1 ml, but you might be taking in out of a 1,500 milligram bottle, you might be taking in 50 milligrams of the CBD. So if they're 1,500 milligrams in the bottle and you're in a 30 ml bottle, and you divide that by the dosage, 1 ml will equal 50 milligrams.
15. Say 15 or 50?
50.
50.
So it's, the milligrams is the amount that you're taking in, whether it's an edible or in the liquid, but the actual dosage we do by the dropper, which is 1 ml. It doesn't have to be 1 ml, but it's all.